Yes, my name is Corey. For those of you that don't know me, I have been a massage therapist for 24 years, and that's what led me to birth work. Just a few years after that, getting invited to a close friend's home birth, where I really got to see how amazing birth was. That was very different from my own hospital birth experience. And her midwife saw the stars in my eyes and asked me if I ever thought about being a doula. Never heard of it, looked into it, I was like, yes, that is what I want to do. And that was 22 years ago. So just the marriage of those two passions, the more birth work I did, just learning so much about getting babies through pelvises is my dorky obsession. In fact, any class I ever teach just should be called Getting Babies Through Pelvises is Cool. But anyway, I started to become really knowledgeable about it because as a birth worker, I would see these babies being repositioned, these labors being stalled, and time and time again. And I was just getting so frustrated with why are we seeing this so often? When you stake your career behind your body is made to do this, why is it so hard for some women and really healthy women? And so I became very knowledgeable with the work with spinning babies and how to rotate a baby that is in a position and get them lined up in a better position. But that led me to learn more about why are we seeing it so often, and study with the body workers of spinning babies. So I studied with Dr. Carol Phillips, who's the mastermind behind a lot of the spinning babies techniques, balancing techniques, and got to know all of those body workers. I also went through Lindsay McCoy's Body Ready Method program, which I highly recommend. I know many people are familiar with spinning babies, but Body Ready Method is very involved. I get a much deeper understanding of what we can do to help our clients prenatally in creating balance in the body and making no space for baby to navigate through birth, which leads to smoother, faster births, and everybody wins as birth workers. So much to know, right? But to be able to just give you all a little piece of that this morning on making all of our lives easier through just smooth the birth progress. So I'll touch on today. So encouraging progress in normal birth. 4 areas that can typically encourage progress is labor flow state. Obviously, you've got to just make sure they're comfortable in their space to tap into their own just natural instincts on having a baby. So that's the first thing you have to look at, right? That midwives know how to do very easily, and I think that's a lot easier for your jobs than you see it less in your birth work than doulas birth works that see a lot more hospital birth. We really have to do a lot to make sure their flow's not getting interrupted. And addressing the physical needs of the birthing person, obviously. Do they need to eat? Do they need to drink? Do they need to eliminate? All of that stuff everybody knows as midwives first. But then beyond that, if we see a stall in progress, we can start thinking about how we can make suggestions with movement and how we can assist with more hands-on role. So the first thing to assess is where's the baby? If we need to step in, usually, right? If contractions are strong enough, she's working well in her birth, and we don't see any outside distractions, probably the issue is going to be baby positioning or restriction in the body that's impeding progress. So assess where's the baby, and not only how the baby is positioned, where their back is, if they're posterior or not, but where the station is really gives us so much information on what we need to work on position-wise. Do we need to get baby to engage? Is that the first thing? I think a lot of us see, well, we see all of it, but a lot of stalls can happen when just baby is not in the pelvis. We're not going to see good dilation when baby's not like putting good pressure on that cervix. The uterus is working harder to dilate. So if we get into mid-pelvis and against tight pelvic floor or restricted SI joint, they can turn, move that head asynclitic or just not want to budge. And then of course we can get stuck at the outlet too. So assess where's baby, and then today I'm just going to talk about just how we can encourage progress through different positions and movements at each stage of the pelvis and hands-on help that we can assist with as well. So if we are getting stuck at the inlet, if we're needing more progress for baby to engage, some positions that we can try. And you always want to try these positions through 5 or 10 contractions. Sometimes you really got to sell it, and just speaking like what your observation is. It's like I see, or we have found through the cervical check, or that we need to be in positions for baby to engage. Because we're not always comfortable, but if we know we're doing it with a purpose, that can make a lot more sense. So tucking and untucking the pelvis in whatever position you're in. Movement, scooping that baby up. If you're hands and knees, tuck, untuck, once to get that baby in. You can do that standing, tuck, untuck, scoop that baby up. Flying cowgirl. Is everybody familiar? Yeah? No? I don't know. Anybody want to be a flying cowgirl example?
Sure.
Why not?
I am in a skirt, so.
Okay. Yeah, maybe this way. That's good, yeah. Why don't you head this way? Oh, head this way, and the skirt can be this way. I mean, we're all comfy here.
Okay.
So with the flying cowgirl, the peanut ball is a really good tool to have in your kit for lots of different ways, but I use them most in like restful positions, but then still that allow movement. But with the flying cowgirl, you get it in between your legs, or sometimes like in between the whole leg, either between the knees or in between the whole leg. And I'm going to come behind you actually. Relax. And then we bring this all the way up. You see the cowgirl? Yeah! Opening up that inlet. Letting baby come through. And sometimes, taking gravity away really can help baby, like, you just sometimes have to coax in this way. Gently, instead of downward. So sometimes this just does all the magic. Not super comfortable, but you can still provide comfort measures with heat on the back, with a little counter pressure here, and even with some movement. You can do tucking and untucking.
Where do you have your hands?
I have my hands. Just need to keep it right here. Need a little pedal necklace. I mean, you can really put them, we're talking about the different hip speeds and counter pressure positions, but I mean, I have it flat on the sacrum right now, or you can put it just right beside here.
Okay.
Huh? Absolutely a jiggle. Yeah, and actually, while you're lying down,
Excuse me, just hang here.
okay. This probably isn't comfortable, though. I'm gonna get you more comfortable.
Okay.
So flying cowgirl and abdominal lift and tuck. Oh man, I use this all the time. Abdominal lift and tuck, especially if you client that has a very, they're carrying their baby way forward, you can notice that they're way here. It's not because their baby's like huge and they look super pregnant. It's because their baby's tilted way forward. These women are probably going to have a lot of pain on their symphysis pubis. And it can just be harder for baby to engage because baby is coming at this angle. It happens a lot of times with multips because they have a separation of diastasis recti. Sometimes tight rad ligaments can pull the uterus forward. Sometimes they just don't have a lot of torso room, and that's just where baby can go. But the lift and tuck can be very effective. You really want to do this through 10 contractions. But with contractions, you have your client lift their baby up and put them on top, right on top of that inlet. So you're lifting, but as you're tucking your pelvis. So it can be good to do against a wall because they can just flatten the small of their back. Sometimes their partner coming behind them can help assist lifting up, and they can tuck back against their partner. It's not like an instinctive movement. Like it doesn't usually, sometimes it does. Sometimes it feels better because, a lot of times they're having back pain too. It's pulling, baby's coming at their sacrum and can create back labor even if they're not posterior. But through 10 contractions, the magic happens at 8, 9, or 10. So stick with it. They've got to stick with it if it's going to work. I would not, and
So if you're gonna do it at all, do it for 10.
Yeah. If they miss one, that's okay. We'll just pick up the next.
Okay.
Pick it up the next. Just do it 3, 10, and just make sure you're there too. It works, and things can really happen quickly at 10, and baby's just getting moved right on through. Okay, and the Walters is the Hail Mary. If nothing else has worked, because it's very much not comfortable. We can demonstrate that one really quick. Just real quick, if anybody needs a quick hands-on demonstration, let me just move these plants. I guess you can switch around this way.
What did you call that?
Walters. So you're going to do this off the edge of the bed, so you can lay on back. And we have them scoot their hip bones all the way to the edge and dangle. Oh, this is not nice. ever want to ask them to do this, and their legs really do have to, ideally are hanging.
Tall.
Yeah.
That seems cool.
But man, this is a drastic opening of that inlet. And it really, really can work too, but that's like plan C. You can do it like a hands and knees Walters or pool Walters, where they're kind of like this. Or in the pool, they can rest their feet on and open up that inlet. The psoas swing. The psoas, especially if you have clients that are work the desk all day, a lot of times their hip flexors are going to be really tight. And that can definitely run right in front of the inlet, so that can create opening and restriction here. So yoga block or, or just a lovely step here.
Am I still being used?
I'm going to use you in a second. Or anybody else. Coming up on a step and just pulling in the leg really juices up that psoas if it's restricted.
You just swing it back and forth.
Swing it back and forth. And not like, you just give it a kick, and just let it swing. It's just creating movement at the inlet.
You make it look so easy though.
Feels good, yeah, right. Sure. Always do both sides. I mean, this is good. This is a good thing to suggest if any of your clients have desk jobs, just to prepare their body for birth. The psoas swing. Yeah, exactly. Yeah, the psoas swing is real good. Supported standing hip extension. Partner behind you, or if you've got a, like the birth swing, or what do you call that?
Sling.
Sling. Getting this kind of extension, I can feel good. Man, it opens all of that up. And even if it's just not tolerable during contractions, just doing it in between can kind of create more movement
And this is for babies that are stuck where?
at the inlet. We're opening up the inlet right now, creating movement and opening the inlet. These are things that we can suggest movement-wise that they can do to create more space at the inlet for baby to come on down, come on through. And of course, like sitting on a birth ball can do the same thing, and they can just follow their own instinctive movement. But it is cool to see women like move instinctively in their births. A lot of time when they're when they're trying to get their babies to engage, they're doing more of a front to back movement. And then when baby comes down mid-pelvis, it becomes more of a side to side. That's not happening instinctively. We can encourage it.
Sure feels good when you're not pregnant.
It does. Yeah, we'll see. This morning. Okay, so hands-on assistance for to help clients' babies engage, to help open up space at the inlet. We can do back and glute shake. You want me to volunteers for shaking some glutes? Can I borrow this ball? So pump off easy. I mean, we know how it looks. I'm gonna need somebody's sacrum here in a minute. Can you get over here? Yeah.
I'm seeing a sacrum.
I'm gonna need, yeah, I'm just gonna do all the things I know.
Chair.
Straight
Get up there. You got it. I'm already standing. Well, you're up.
You got voluntold. Hands on, hands and knees over the ball, please. Are you always gonna push? You're gonna want your, yeah. Be engaging anything. But jiggling's always good. It just you can't have tension when you're being jiggled. And it can kind of reset the nervous system. So we're used to jiggling always being back here, but you can also jiggle here.
Y'all should have volunteered.
Yeah, you can also jiggle here at the inlet and jiggle up that low back. And yeah, they're getting nice and relaxed. How long are you gonna do it? 5 or 10 contractions?
Or anytime.
Or anytime.
You pass by.
And this is something, yeah, this is something you can, definitely engage in partners then, too. But this is also if they're feeling just, if they're having trouble getting out of their head, it's also hard to hang on to any stress when you're being jiggled. But just remember just where you're jiggling, depending on where baby is. Heat on low back also, when we relax that lower back. Or heat, if they're feeling pressure right at symphysis pubis, that can help relax enough for them to relax muscles and let baby come through. The tucking sacral press. You can do this in a few positions. You can do it on your hands and knees, but what you can do is just assist, or help make more space at the inlet by pressing down on their sacrum. Look at this. That's pretty good. You can feel that. In the openings, you can see your sacrum moving. So we can do this with contractions, but make sure that you're not at the top here and creating like restriction here. We want to be lower towards the bottom, making more space here. We don't want to be pressing here, we want to be pressing here. But you can also do this on the side.
Do it at the back table?
Yep, that's much better. Just in that back. Let's do also, when you use the peanut, is that not one thing there?
No, it's your sacrum. Your sacrum's in the way.
See? Keeps I haven't seen it over. I need it. When you're placing the peanut ball, you're also placing it, depending on the way you place it, depends on where baby is. So if we want baby to engage, we're going to place it so that the knees are externally rotated, creating more space at the inlet like this. And then we can also assist with that sacral press from the side. Like this. And then another hands-on tool can be SI joint mobilization, where we are having one hand on the ASIS here and one hand on the sacrum and doing just a gentle rocking like this. Let's see the force. But you feel that movement in your pelvis. And it's just encouraging movement with contractions. Scooping that baby up. And if they've got a locked up SI joint, I mean, this can be just a hands-on, maybe needs a little bit of encouragement to be freed. And that can be helpful. And these are good restful positions, right? We have to balance active positions with restful positions. So that's a way to encourage, with restful positions would be flying cowgirl, peanut with the external rotation. You can assist with sacral SI joint mobilization or sacrum press. Okay, thank you, ma'am.
You're welcome.
Lots of layers down here.
Yeah.
Okay.
Okay, we got that baby in the pelvis. Baby's in the pelvis, all's good, or maybe we have no issues at all with getting baby in the pelvis. But we can sense a stall in labor either through a cervix check for dilation, or just, we just have been at this level a long time. We don't see it getting further. You can just kind of tell maybe we need some encouragement. I got a hard stop in there.
Till the next speaker goes.
Okay, cool. When you are mid-pelvis, when baby's mid-pelvis, when you're working on engaging, you want to create more space in the inlet, front to back. When baby is mid-pelvis, you want to create more space asymmetrically, side to side. So positions that can be good asymmetrically are lunge. You can do a forward lunge or a side to side lunge when we're doing asymmetric. Especially like some kind of combination of that. Because when we're a little bit forward but lunging sideways, you're opening up, like we're rotating this way. So we're really creating mobility mid-pelvis. We always think of lunging as like a way to get baby in, but really it's a good way too to get baby through. And you're rocking during contraction, that movement during contractions. Really, it's like a cup and ball game, right? You gotta just keep moving your pelvis. Get that baby through. Hands and knees with one knee up is another good asymmetrical position. This is when I wish I had my yoga block and that thing's gonna be way too much. But hands and knees, just slice the little yoga block under here. Like, ooh, this might feel good. And then they can do a side lunge if they need to. But it's just creating more space mid-pelvis. Ooh, have y'all ever, I had the coolest birth this week, do with a mid-pelvis baby with the fire hydrants. Have y'all heard about this one?
With what?
Fire hydrants. We have over the ball like this, or it's actually over a ball, and had this tucked up like way under here like a dog peeing on a fire hydrant. So it opens up their whole mid-pelvis. And it is a little bit more restful, so.
And maybe just slid out.
Baby went from, it took us so many hours to get to 6 centimeters. And then that baby went from 6 to complete and out in like an hour and a half. Wide leg squat, opens up the pelvic floor. A lot of times babies get stuck mid-pelvis because of a tight pelvic floor. Come down against a tight pelvic floor and become asymptotic. So opening up mid-pelvis, doing pelvic floor releases. Sideline release works at any stage. Always just sideline release. The peanut ball is another good position for mid-pelvis with the mid-pelvis peanut. Notice with mid-peanut, the bottom leg is straight and the top leg is out like this. So we see we've got an asymmetrical pelvis that way. One leg is up, one leg is down. And then toilet. Toilet is a great way to release your pelvic floor. And in toilet with a yoga block or stool under one leg is a great asymmetrical position. Hands-on assistance with mid-pelvis. Anybody want some hip squeezing? Volunteers today, get on here. You are my volunteer. Come on, girl. Let's do. Hands and knees, bottom point too. Yeah. Okay. Hip squeeze at ASIS. Always when we think hip squeeze, we think about just right here, right? And squeezing inward like this. But when you hip squeeze at the ASIS, the anterior or superior iliac spine, you're creating space in the pelvis. So squeezing here. And then rocking through with the peanut ball. Lay on. Yeah. Let's do side to side.
That's good.
This way.
Very good.
Okay, so we have asymmetrical peanut ball. There we go. Peanut ball for asymmetrical pelvis. But the great thing about the peanut ball, being helpful with a restful, another great thing about the peanut ball being helpful with a restful position is that you still can allow movement, like you can assist with movement. And they can move themselves. You can't do that with just pillows as well. With a peanut ball, you can. And then you can assist too at the ASIS. You can do hip pressure here. And that can really help with comfort in a sideline position. The sacrotuberal release. Sacrotuberal ligament is tight on a lot of people, especially a lot of people that sit all the time. It is between the sacrum and the ischial tuberosity. Right about here. If they were wearing jeans, it'd be right about on that pocket of a jean here. But also, you'll be able to feel